It's time for us to get love right, folks. And so we invite you to check out the King and Queen of Hearts.
This is an incredible training for couples who are struggling in unsatisfying sex lives.
It's also for lifelong learners, people whose relationship is great and they want to make it even better.
In this 3-part training that is filled with 8 different tutorials like the art of tantric kissing, eye gazing that is deep and intimate, connective, and not creepy, and sacred sexual meditations, you do them with your lover to juice you up before sex. Communication tips and really, really valuable relationship essentials are all found in this training.
You know, a common mistake couples make is they wait, they put it off, they avoid, they resist. And if you want to continue doing that, well, good luck. But if you really want to make a change, get this today. Don't let another month go by where you're losing precious connection with your partner.
Plus, you can't beat the price on this program. One of our clients, Casey, said a spark in their intimacy is back on track.
Now, Sarah and her husband, you know what she told us, Willow? She said, finally, he learned how to kiss her right.
Oh my God, hallelujah. So happy for Sarah.
So if you want some radical changes in your love life, go to sexreimagine.com, click on courses, and scroll until you find the King and Queen of Hearts. And because you are a fan of the podcast, you can use the King and Queen 10 code in order to get 10% off. That is King and Queen 10, and you can use it in the checkout. Welcome back, Pleasure Seeker. We are your hosts, Leah Piper and Dr. Willow Brown, and we are so excited for this guest today.
I know. Today we have Dr. Anne Truong, who is an expert in ED, and she just has so much wisdom to share with you. It's kind of insane. You're going to want to take notes on this episode. Like grab a pen and paper because there's just so much to learn. If you are either suffering from ED or looking for to help somebody who has been suffering with ED, whether you are working with them hands-on or not, there is actually so much that you can do. And so tune in, turn on, and fall in love with Anne. She is a wealth of wisdom and loves to empower men and women to have more sexual confidence in their life.
That's right. She's got a book. She's got a podcast. We're going to put all those resources in the show notes, and our transcript of these episodes are included. So you can always take notes by downloading the transcript. Take a look at your favorite podcast app and see if you can find it. And of course, you can always email us at support@sexreimagine.com if you need added resources. Let's dive in with Anne.
Welcome to the Sex Reimagined podcast, where sex is shame-free and pleasure-forward. Let's get into the show.
Welcome, Anne. We're so happy to have you on the show. We've had the privilege of talking with Dr. Anne a couple of times through her podcast and her summit, and it's a real treat to have her on our program.
Well, I'm glad to be here. Thank you for having me.
Yeah, I always love talking with other doctors, especially medical doctors, about some of these topics that we tackle from a holistic, from an ancient sexual arts perspective, but it's always good to get more perspectives. And, you know, Dr. Anne has written a fabulous book, which if ED is something that you have been curious about how to support someone with or struggling with yourself, she is a wealth of information when it comes to natural remedies that you can utilize. And I was just saying to Dr. Anne right before we hopped on, I want to get your book because I've got my own slew of natural remedies, but I'm sure there's something in there that some little nugget that I can learn that I can add to my, my repertoire.
Your book is called Erectile Dysfunction Fix. So we're talking penises today, folks.
Erectile dysfunction is without medication or without surgery, using all natural technique and also your own stem cell to help repair the blood flow.
I'm so curious about that. Let's dive into that right away. Like
stem cells.
Yeah. How do you use the stem cells to support men in getting their erections back?
Well, it's already in our body. It is already working in our body. Let's say, for instance, if you cut yourself with, on your hand, right? When this blood oozes out, Well, in the blood, there are platelets. These are cells that looks like a little balloon. They comprise 1% of your whole blood. And what their job is to go in and clot the blood so you stop bleeding. And then their job is to say to the other cells in the blood, hey, there's an injury here. You need to start healing. And it honed the other cell to come to start the healing process. So it's called the wound healing process. It's what we go through anytime we have a cut, either by accident or by surgery. Well, we've learned that if we put whole blood in a wound, like an open wound, like if somebody is paraplegic, have an open wound from a non-healing wound, that blood start healing. So then we go, what's responsible for that? So it's the platelet that's already in your blood, that's already there. Well, how we do it now is that that we started discovering that around 1998. And then now in 2024, what I do is I draw out your blood as from a vein, as if you go to the lab, and we put it in a centrifuge, and the centrifuge spins the blood separated by the different layers like red blood cell, white blood cell, and then the plasma, which is just the fluid, the protein. And then we take out the platelets, we isolate out the platelets, and that is re-injected into the penis. And that's what that starts the reparative process of that tissue. So when a tissue is repaired, what happens is that when the tissue is not healing, it's repaired, the cells start making more blood vessels. There's little micro blood vessels that start to lay down the foundation for blood vessels that starts as micro and then it starts to be bigger. So that way it increases blood flow to the area. You can only heal if you have more blood flow to the area. As with anything, a broken bone, hair, anything that needs healing, you need blood flow to bring in the nutrient from your blood to the area to start healing. So essentially, it's a booster treatment, boosting the healing.
Where does the injection go into? Is it like under the scrotum? Is it into the base of the penis?
Right into the shaft of the penis.
Okay, right in the middle of it. It can go anywhere in the center?
Well, you want to avoid 12 o'clock because that's where the nerve and the arteries are for the penis. You want to avoid 6 o'clock. That's where the urethra is. So anywhere between 3 and 9 o'clock, if the penis was like a clock, kind of like the left and the right side, kind of the same area that men do when they do trimix injection. Right? So
what's trimix injection?
Trimix injection is an injection that has 3 medication in it that help a man with erection. But that's the last resort. I don't recommend that.
Stem cell is
much
a lot
of men
more
use it.
natural and better for
more natural. It treats the cause of the problem because why men have ED is because they have decreased blood flow, and the stem cell increase more blood flow down. Now it takes time. It takes about 3 months to 6 months to really see the result.
Okay.
But as in anything worthwhile, it takes time, right?
Yeah.
But it treats the cause of the problem as why a man has ED, and then on top of that, we also coach the man into diet change, exercise, stress, and sleep as well too. But that's how stem cell is really harnessing something you already have. It's already working and healing, and then just putting it into an area that needs healing.
What's the success rate?
Yeah, and also how many stem cell treatments does a man usually need to get in that 3-month period?
Right. So to answer what is the success rate? Success rate is almost like 90%. The reason why the other 10% is that not everybody heal at the same pace. And there are other consideration, like is there smoking involved, alcohol involved? Those slows down healing as well as the diabetic as well. So not everybody can have this. And then to answer your question, Willow, is that is it a one treatment? If you have severe ED, meaning if you're not responding to Viagra or Cialis and you don't have morning wood anymore, and you're diabetic, high blood pressure, you're in your late 60s, that's probably severe ED. You're gonna need probably 3 treatments. And then if you're early 50s, fairly healthy, just have high blood pressure, then it's probably just need 1 treatment. Again, it depends upon how the man take care of his body.
Right,
Your
So
body
you're
is your
looking at the
temple,
whole
right?
thing when somebody comes in with
Yes.
ED. You're looking at you're running labs on them. You're looking at their blood pressure, their cholesterol. You're
Their
looking at
Yep.
medication.
all these things, what meds
That.
they're on.
Yep.
Yeah.
Yep. We do a comprehensive blood work before they even set the door, set the foot in
Step
the
in the
door.
door.
That way, I can look at their hormones. I can tell how they're healing. I can tell if their body is stressed. Look at their liver, their kidney, their
Yeah.
cholesterol, all that, because I'll take into consideration, because I want everybody to get better, but not everybody is able to heal as well. So, and I want to make sure that we have straightforward conversations, say, we can do this, but likely chance that you may not get a response is 50 if you're diabetic and you're smoking. And I
Yeah.
honestly discourage people from getting if they're still smoking, because
Oh.
if you smoke, you might as well say goodbye to your erection.
Does that include the
That
marijuana
is, yeah.
too,
Tell
Anne?
tell us more about that. Yeah.
Yeah, well, smoking is very inflammatory to the lining of the blood vessels.
Oh,
All
okay.
right. And so when you disrupt the lining, think of blood vessels like a pipe, and the lining of the blood vessel is kind of like a soft, glistening cell layer, one cell layer, very, very thin, 2 micrometer, all right? And very thin, but that cell layer can be disrupted by nicotine. And what happened is that cell start to be to leak. They start to have leaks.
Okay.
So therefore, when it start to have leak, the pressure is not as good, and then toxin in your body start leaking into your tissue. All right. So that's why it's bad, because not only you don't have enough blood flow, you start to have the toxin that's just supposed to be filtered out of your body get absorbed in the body.
What about
And
marijuana,
so,
Anne? Does smoking marijuana have the same effect?
well, as you know, there are many different type of marijuana, many different breed, but different plants and so forth. So that's a big generality, right? That's a big generality, but it all depends upon the dosage, how much you smoke, right?
Right. If somebody's smoking
Yeah,
giant bong rips all day
right,
long, that's
exactly. I mean,
probably
if
going
you're
to be.
smoking like this much,
Yeah.
that like twice of that a day, yeah. Because again, it's foreign. Anything that's foreign, non-organic, that you bring into your body's going to react to it. All right.
Now, when
But
you
if you're
say
smoking on the
non-organic,
weekend,
what you really mean is not endogenous, right?
yeah, right.
Okay.
It's not.
Because there could be
'cause
organic
tobacco can be
marijuana
organic
out
and
there and organic
yeah.
tobacco.
Yeah,
But if you're
right.
smoking
That's
a ton
not
of
that.
it,
That's not
And
cellular. That's not
right.
organically cellular.
I'm
Right.
also, is it right to assume that if someone was eating edibles versus smoking, edibles wouldn't have the same effect on the blood vessels? It's actually the smoking and the inhalation that is problematic?
Well, that's a good question. That is to be determined. There is
Okay.
a new research that has come out I did release an episode on my podcast about marijuana and sex. And right now, that we do know that smoking too much of marijuana is not good for your
Right.
sex life. And when
Right.
I say too much, it's like if you're smoking a joint every day,
Right.
and so on the edible, it's still up in the air right now. Again, depending on what type of edible, how much edible you
Well,
you
yeah.
take,
So-
and then also your existing your medical condition. If
Right.
you have high
Sure.
blood
Right.
pressure, you're obese, you have high cholesterol, and your diabetes, you don't exercise, yeah, it will affect you. So it's almost like, what's the vessel that
Yeah.
it's in there? But if you're
Yeah.
healthy, it may
Well,
not affect you as much.
Right, exactly. The other thing about marijuana and high use of it is it's an estrogenic plant. So it may not directly cause ED, but it can definitely lower and diminish your libido if you're in a male body. So, using it sparingly can actually enhance your libido and your sex drive
Especially for
and
women.
the
as it
sensation of
seems.
it all. Yeah. But women can really get more horny on weed for sure. But men, it's all about moderation and balance. Pretty much.
Exactly, all moderate. But Leah, you're right. For women, marijuana doesn't have the adverse side effects as men, because for women,
Right,
it does
interesting.
increase their libido and it
Mhm.
does actually increase their ability to get orgasm better because
Uh-huh.
women and men process arousal differently in the brain area as well as the blood flow distribution too, right? Because a man needs to have this study is like he needs to have 400% more blood flow into his penis for to be erect compared to
Than
a
a
woman.
woman's vulva,
400% more, yeah, than a woman
400% more
vulva.
blood flow.
So
Interesting. That's very
Yes,
interesting.
yes,
that prompts another
yeah.
question. Back to the platelets. How much of an erection can someone hope for, right? I mean, there's different varying degrees, like you said, of how much blood is actually circulating to the penis. There's the purple burster rock hard, and then there's kind of the semi thick, right? You got more of a semi. I mean, I'm sure this is all dependent on what the patient's blood flow is currently. And they're not happy with the amount of blood flow. They're feeling too, I hate some of this language, like limp or flaccid. They're just two terrible words. It must bring up so much discomfort and shame for men, but they're still good descriptors. So when someone has this treatment and they have been having a really hard time with blood flow, can they expect 30% increase? 50%, 70%? What's the average?
Well, they with the full treatment and if they work on their diet and their exercise level and stress reduction, they should expect a functional erection. When I say
Wow, that's just
functional erection,
wonderful to hear.
penetration, the whole thing. We have seen men that had prostate surgery, and this is the worst a man can have. Is that he
Right.
gets surgery, they go in there, cut out the prostate and cut it out, and 95% of them have ED because the nerve to the penis goes on top of the prostate as well as blood vessel. So not only you affect the erection by nerve, but also by blood vessel. So
Right.
almost 99% of them have ED, but we have seen men resume to have erection and to have
With
a
the stem
functional
cell
erect
treatment.
penis with the stem cell treatment, even
I
after
love this.
prostate
Brilliant.
This is
surgery.
very exciting.
This is
Yes.
like,
Now,
I'm like,
Yeah.
hallelujah.
I
This is like
know.
such
I
good
know.
news because
Now,
I've
what
just, so many men suffer.
yeah, and what about like
Yes.
penis pumps in conjunction with stem cell work?
Let's take a quick break. Hey guys, what would it be like if you could last 10 times longer when you're having sex?
We are going to teach you how to gain massive confidence as a lover, all without performance anxiety, gimmicks, or prescription.
This course is perfect for you if you've ever been mortified by a sexual encounter that ended way too early.
Or if you've ever avoided intimacy out of fear that you won't last as long as your lover desires. Or maybe you long to give your partner multiple orgasms but can't last long enough to make that a reality.
Well, good news, we've got your back. And it's in our course, Last 10 Times Longer. Go to sexreimagined.com/last dash the number 10 X dash longer.
And for all of our favorite listeners out there, we are giving you a discount, 20% off, y'all. Just put in podcast 20, all caps, podcast 20 to get your 20% off of this phenomenal course that you're going to want to review more than once.
The link is in the show notes. We cannot wait to see you inside this course. Plus, don't forget, we always got tons of bonuses. See you there.
Oh, it works synergistically. It is like putting kerosene in the fire. It worked together. So our recommended regimen when you do the stem cell is penis pump, nitric oxide, nitric oxide supplement, and we also tell them to use the penis ring. They can because I keep the blood flow in there, keep it
The
expanded
cock ring.
as well. Yep. And then we stress, a diet because what you eat is what is in the blood, right?
Yeah.
Yeah. Say more about what that diet is. What do you recommend people eat?
Yeah. Well, Mediterranean diet, which is really more more vegetables. I tell the guys, and on your plate, put 3/4 vegetables and the rainbow color as much as you can. And have one serving of carb a day and lean meats like fish, chicken, pork, and then red meat, twice a week or once a week. And you can have you're allowed to have a glass of wine a day. So the Mediterranean diet has been endorsed by the American Diabetic Association as well as the American Heart Association for decreasing heart attack risk and stroke risk as well as diabetes. And it's very, very easy to do. It's essentially that's
delicious.
it. It's really
Yeah.
vegetable. Yeah. And it's healthy. It's delicious. It lower your blood sugar. It also lower your risk of heart attack as well, and it helps with your erection. And you don't have to. It's not like paleo or keto. It's not that strict. You're allowed carb, but I tell patients don't eat anything in a box or a bag. Yeah,
that's
in
good.
small
Yeah.
doses. Yeah, don't eat
Mhm.
anything in a bag or a box. And less red meat.
Yeah, if somebody that's great on the diet. I often will get people to do actual liver cleanse to get their diet kind of reset. Yeah, and to get all the exogenous estrogens that are coming into everybody's system these days based on the toxins in our environment, plastic water bottles, soaps, detergents, inorganic food. I mean, we're really swimming in a lot of exogenous estrogens already as it is, plastics and stuff. So doing a liver cleanse is a great way to get all of that out and to reset your diet toward a Mediterranean, or I do say paleo to a lot of people. But I say, but you can eat a little bit of carbs. So it's basically the same as what you're saying, Dr. Ann. And I'm
Yeah.
curious too, like you're in Virginia. What if somebody is in New York or California? How can they
treat them?
find somebody who does stem cell replacement in their area? And can they also
Right.
work with you virtually, or how do you work exactly?
Yeah, so we can see patients virtually as well. But the treatment, they have to come to the office in Virginia, which is an hour right outside of DC. And so a lot of patients kind of come in the morning, get the treatment, they fly out that night. And so we make it so that it's very, very easy to go in and out. And most of the time, it's one treatment. Men that are listening to this or their partner listening to this, if you start early, you're probably just going to meet one treatment, right?
Okay.
And if you
That's
wait
good to
until
know.
10 years, 20 years of ED, and you've been
Yeah.
popping ED pills for like 10 years, it's going to take a while. It's going to take more
Longer.
than one treatment.
Right.
So we see men in their 50s, 60s, when they maybe have a year or two of ED and they don't want to take meds. Those are the ones that are winners. One
Oh, great.
treatment, and then they just tweak their diet a little bit, exercise a little more. They're good. Oftentimes, we also recommend that they continue on testosterone replacement therapy because
You do recommend that.
testosterone, testosterone drop 1% a year after the age of 35 for a man. And the penis tissue needs testosterone to help with the erection as well. So the penis tissue has more receptors in there than any other tissue for testosterone. So when your testosterone level is low, it is not primarily responsible for the ED, but it can contribute. So that's what I'm saying. So if a man has ED, if he gets testosterone replacement therapy, it may not correct his ED, but it certainly will contribute to the erection getting better.
And
then, so there are other factors as well.
Go ahead, Leah.
Where do you stand on medication? Would you recommend or not recommend Cialis or Viagra as a
Cialis and Viagra are the same thing, correct? Or no?
I think they're different.
Yeah, they work the same thing. They work the same way. Because they inhibit the removal of cyclic GMP. They work the same way, just different name. Cialis just longer lasting. Cialis can work up to like 30 hours. Viagra lasts only 6 hours. And the onset of Viagra is within 30 minutes to 45 minutes versus Viagra. The onset could be like from 1 to 2 hours. So it's a different mechanic, but it works the same way. That's why Cialis sometimes is prescribed daily, and Viagra is prescribed as needed. Well, I'm more of a proponent of. I'll tell you why. Is that I'm against medication because I feel that medication should band-aid the problem and not treating the source of the problem. If a man has ED, right, and if you have ED, you need to get blood work. It's the first thing you need to do. get blood work, because it could be the first sign that you have diabetes. I can't tell you how many patients I see in your office, and I'll ask them, they would never had a blood work in like years. And we do blood work and they have diabetes. I mean, they have blood sugar that is off the roof. So oftentimes get blood work first to see if you have high blood sugar, you have high cholesterol. Maybe your kidney's not working well. Maybe your liver's not working well because you've been imbibing too much alcohol. Maybe you're anemic. So all those factors play a role and then you can be low in testosterone as well. You could be low in thyroid. So we can find all that through blood work. I'm not a proponent of a man using ED medications or first line treatment, because it's almost like putting a Band-Aid in a bleeding wound. There's a reason why you have ED. Find out the reason, and most of the time it's treatable. It's either treatable through diet, exercise, or just lifestyle modification. I would tell you the top 3 reasons why a man has ED is because poor diet, is because low testosterone, and also high blood pressure, and obesity. And lifestyle, I'm talking about alcohol and smoking. All right. So those are the 2 main things. All right. And those are all modifiable. They all can change. All you have to do is change your diet and your exercise and stop doing the bad stuff. And then you can literally reverse ED. We have seen men so I also have an online coaching program as well, where they don't come to my office, but we coach them on things that they need to do to get help with ED. And we're seeing men that have ED, and all they did was just kind of eat better, exercise a little more, use the penis pump, and they're starting to see morning wood coming back again. So my point is that the medication is a Band-Aid. And what happened, you take medication over a period of time, the problem while you had ED never been addressed, so the ED gets worse. So with men, when they take ED medication, the span's about 3 to 7 years when they're going to notice that the medication doesn't work anymore. Either that, they escalate the dosage, where they used to start with 25 milligrams and they go up to 100 milligrams. Some even take 200 milligrams.
That's
and
way too much.
Viagra and Cialis have very severe side effects. One of the side effects, you can stroke out, you can die.
Yeah, I was going to say, isn't it bad for high blood pressure if you have that? Yeah.
Let's take a quick break.
Ladies, do you want to explore your sexuality and experience true sexual healing?
The Vaginal Orgasms Masterclass teaches you and your partners how to unlock your full sexual potential and awaken the G-spot, the sacred spot, and the cervix for an unforgettable sexual experience. Would learning how to finally surrender and release grief, fear, and uncertainty benefit your outlook on life, love, and relationships? We certainly think so. Common misconceptions of the G-spot, including its anatomy and function as an erogenous zone, will be covered in this course.
Plus, we're going to teach you 7 different massage strokes for the G-spot that dissolve blocked energy and increase your pleasure tenfold.
We're going to teach you how to locate the sacred spot and the best methods to stimulate it for maximum pleasure.
And you're going to learn about cervical orgasm techniques, which are the most powerful and also often elusive style of climaxing. You know, this class is primarily geared toward women, but men have taken it as well and learned so much about how to pleasure their partners.
So get ready for multiple O's, my friends. And you can get all of that at sexreimagine.com/female-masterclass. And for being a listener of the show, we've got a beautiful coupon code for you. It is 20% off this course. Just type in podcast20, that's all caps, podcast20, and get yourself a great deal on this on-demand course.
Well, actually, it lowered your blood pressure so low that you passed out. That's why you get dizziness and headache. Because it's a vasodilator. So it opens up blood vessels, and
that makes sense.
then the reason why you have heart attack is because you're not getting enough pressure to blood to your heart. That's why you get a heart attack, and you have a stroke because you're not getting blood up. You're not getting enough pressure up to your brain. That's why you have a stroke. And then, but that's one of the side effects that you hear a lot about: the blue vision, the headache, the dizziness, the heartburn, the back pain, and the
Yikes.
bloating, the heartburn that men have because of that. But a lot of men live with that. They live with those symptoms every time they take Viagra because they're able to have an erection. So
Right.
my
It's
point
so
is, I
psychologically
encourage men.
motivated.
Yeah,
You know,
yeah,
I would
exactly.
I,
It's a quick fix, right?
I would love for our audience, and if you could define erectile dysfunction as you see it, and also as the medical industry currently sees it, because I have had clients come to me who are like, I have ED. And then, once we kind of get in there with them, I'm like, you don't have ED. Like, you're
Right.
fine.
Yes.
It's all in your
clearly
fucking head.
operating. That's a
Right,
good
yeah.
point, Willow. Yeah.
So,
it's like, I don't have
Well,
erections.
yes.
Really? I'm looking at it right now.
Yeah, this is looking like an erection to me. I'm not sure what
Maybe
your
you're
problem
bored at home and you're not getting your erection, but when you're right here in this office, what part of your erection aren't you recognizing?
Yeah, so I would just
Yeah,
love, like, what
I
is
know.
the definition,
Well, the diagnostic definition and
Yeah.
in the medical diagnosis is that inability for a man to have a functional erection that he's not able to penetrate. If you're not able
Okay.
to penetrate and it bothers him, then it is ED. So
Got it.
that when it says it bothers him, it eliminates. It's just a one-time thing. It eliminate. Oh, just last week I couldn't get a full erection, couldn't penetrate, but this week I can. So it get to a point where it bothers him and that he's not able to penetrate. So it's really the rigidity is meaning you're not able to penetrate. Well, sometimes you can have a semi-rigid, a penis, and you can still penetrate. And once you penetrate, you will get more hard, right? So it's the degree of whether it bothers him or not. So, and what you're describing, I see that too. And, a lot of men, the studies have shown that 87% of men feel that their penis is small. When an average size penis, accounting for all races and all age, is 5 inch. 5 inch and a
Right.
quarter inch, 5 inch and 1/4. It's the average, right? And so all men think they need to be 8 inches. That's not the case. And the average girth is 4.5 inch.
Okay.
And not to
4.5
mention
is how it
the
is.
penis
Yeah.
that the length that we see is just kind of half of what's there. There's more penis inside the body
Yeah.
that people are not accounting for.
Right. With the perineum, when that
Yeah.
gets erect, I mean, there's a lot of underground penis
Yeah,
happening.
yeah, underground.
That's why
The
they think
underground penis.
yeah,
You
it's
guys,
like-
a new podcast is born.
Yes, we know you have 80 inches. 2 of them are underground.
Yes, that's right.
Let's celebrate those 8
if
inches.
the
Y'all got it.
No, you're right. You're right. So
Um,
I don't know. I mean, but some men will reach out to me and say they have ED too, and then we'll ask them. Oh yeah, I can get erection. I can have sex with my wife, and it's like, what's the part that's ED? Well, I can't do it, 5 times a day. So they think that's ED. Or they
Yeah.
or that they can't do it, or that once they
Or that
ejaculate,
they can't
they can't have
keep
another
their
one in 10 minutes
erection
later.
Yeah, or
Yeah.
that they can't keep it for a long time. They feel like they can't
Yes.
sustain long
Sustain
enough.
it.
Right.
I feel
That
like in
seems more
those
problematic.
situations, it's often because they're going too hard too fast. They're like losing their sensitivity because they're just having
Banging
a fuck
away.
fest. Yeah, and they're not like paying attention to,
Well-
but they're afraid to go slow because they're afraid they're gonna lose it. So there's all this like fear. There's a cycle involved, a psychological cycle of like, if I go too slow to really feel the
If there's
sensation,
not
then
enough
I might
friction,
lose it. So I
yeah.
got to go really
Mhm.
fast and hard, but then that numbs them out and doesn't feel that great to the woman. So then there's this whole dynamic going on that's not conducive to staying hard longer.
Which leads me to a question, Anne. When you get someone's blood work back and their lifestyle quiz or whatever looks like they're at their optimum, do you then go, this is more in your head? There's anxiety that's coming up. You're so afraid that you're not going to be able to penetrate, that you block your body from being able to relax into sexuality. How much do you see as psychological with some of these guys who are coming into the office?
Right. When a guy has ED, there's some psychological component to that anyway. But luckily, we do have an objective way where we can determine if the ED is physical or not. So if he comes in, I can actually do an injection of the trimix, which is a medication where I inject into the shaft of the penis. And then he just, I have him just look at some magazines or something. It will actually help him get an erection without being with a partner or being aroused. So it gets an erection. And then I look, and then I use an ultrasound. So same ultrasound machine that you look at babies on a mom's stomach. Well, I look at that, and I look at the penis when it's erect. It has to be fully erect, and we can determine the pressure of the blood in the penis, where the pressure is enough for it to create an erect penis. And we can look at the veins, we can look at the arteries, and we look at how the blood fills in the tissue of the penis. Okay, the penis is like a sponge, and it fills up with blood. And so we see all that. There are numbers that we can measure with the pressure, the blood vessels, the pressure in the penis that can determine whether he has low or high pressure in the penis that can contribute to ED. So that objective test is called the penile Doppler ultrasound. So by doing that, we can say, okay, there's enough blood flow in your penis that you should be able to get an erection. If you're not, then it's most likely more psychological. So I want to make sure I do everything to rule out physical causes before, I say psychological. But having said that, I want to also say that if a guy has ED that is due to physical causes, there is also a component of the psychological component in there as well, because he's going to be worried that, hey, am I going to get erect? And I didn't get erect last time. I don't want to try again. So he's thinking about it as well, too. So there's that part of it. Once we work with men and they're able to have erection, he has to overcome that aspect as well. That's why we treat both. We teach them that, and then we also advise them to do like meditation or, the app to help with calming the heart rate in the sense. I recommend men use the Muse band. Have you heard of the Muse band?
What's that?
Even women too. It's actually a device that you put on over your head like this. Looks like a headband. It actually measures brainwave activity like an EEG. Almost like it measures your brainwave, and it can sense if you are stressed and you're anxious. And by those brainwave that is measured on the band, you can actually get feedback, and it gives you
as biofeedback.
That's a biofeedback, and you hear it in your headset, and you hear either chirping birds or you can hear silence. So you want to hear silence instead of chirping birds. So you can literally train yourself. Muse, M-U-S-E. M-U-S-E.
Kind of like the Heart Math Institute has those little things you put on your body, and you can make sure you're in coherence between your heart and your brain. That would be another good biofeedback tool for them, I imagine, right?
Absolutely. Yeah, you guys can consider that working with your client on. They have training classes. The Muse company have training classes on that where the men and the woman can wear that. It will give them feedback whether they're anxious or stressed. When they're having intercourse.
I'm going to check that out.
It seems that there are a number of treatments, and I apologize that I can't remember the names of them, where they're using sound waves to help build, I think it's collagen, or maybe it's blood flow in the penis. I know that a lot of them are correcting Peyronie's, say that right? Peyronie's disease? When you have a bend in the
curvature.
Yeah. Do you use any of those treatments? I always want to call them lasers, but they're really working with sound wave. They're not working with light.
Right. So what they're called shockwave machine. Okay. They're called shockwave machines. So there are two types of shockwave machine. One is called focus. The other one is called pulse shockwave. And there are two differences. It's like a Ferrari and a Toyota Camry. All right. Totally different engine, totally different mechanics. So the focus shockwave machine works more like a laser. It's deep, it has a lot of high energy, and it's targeted. That's the one I use, and that's the one that's been written in research paper hundreds of research papers have said that that focused shockwave help
Is
with
that the Ferrari?
ED. That's the Ferrari. That's the
Gotcha.
Ferrari, right? And then you have the knockoff version, which is called the post shockwave therapy that you hear like Gainswave or the Eclipse
Gainswave.
or the other one. Those are more post. Now those are very good for like using it on tissue, like your trigger point or for like area the muscle tension. But it doesn't go deep enough or the energy is not strong enough to create increasing blood flow. So it's just a little bit better than a massager because it's actually classified as the same as a massager. So that's why you can use it without a prescription. Versus the focus shockwave, you need a doctor to use it.
Got it.
How much are those
Yeah.
treatments, and how many treatments does somebody need to see results? And is that an ongoing treatment for every year they should be doing it, or they do it once? And
Well, they do it once, and we usually do it together with the stem cell, the platelets,
Do it at
stem
the same
cell,
time.
at the same time. So
Cool.
they need about a 6 treatment, about 1 week apart. Some need 12 treatment, which is we do 6, and then we take a break for a month, and then we do another 6,
Now,
1 week
6 of
apart.
the focus, but not 6 of the stem cell.
No, 6 of the focus
Okay.
only, but
Okay.
the stem cell is 1 treatment, maybe 3.
Okay.
But if you start early, 1 treatment.
Is enough.
And
Okay.
you only do 3 if, you have very severe ED at all. So
So that's
I want to
severe.
differentiate that because you're going to hear a lot about shockwave, but you got to delineate whether it is focus shockwave or pulse shockwave. They're very interchangeable and they
Okay.
do not work the same.
Okay, interesting.
okay, what about ejaculation? So, we're of the world of Tantra and Taoism. And so there's ancient practices that we often suggest that for with men who are suffering from ED, for them to regenerate is to monitor how much they're ejaculating. We want them to be sexual more often so that they're actually feeling their sexual energy, they're engaging with their turn on, they're engaging with their arousal. But instead of squandering it, they actually reabsorb the life force energy by bringing all that energy back up into their system by not ejaculating every time they're sexual. Have you explored any of that? Have you heard of that sort of thing? And what are your thoughts?
Well, if you really look at the research, and I actually did an episode like no fob. No, is it called November? No ejaculation November, right?
Okay.
And I did an episode on that. So the research has really kind of showed that if you hold ejaculation, it doesn't make you more virile or it doesn't make your erection better or anything like that. It will make you probably more aroused and increase libido, but as in the quality of the penis function, not so much. And so base it off the research, but I'm more a proponent, if a man finds that his erection's better, his libido's better, his performance better, go for it.
Yeah.
And does it work for him? And I don't see any problem in not ejaculate. One of my very good friend and mentor, he would go for like 3 months without ejaculating. He multiple orgasm, and he would have intercourse with his wife, 2-3 times a day, but he would go for 3 months without ejaculating. And he's a big proponent of that. And
How old is
I know
he?
my husband, he is 62.
Let's take a quick break. Hey guys, what would it be like if you could last 10 times longer when you're having sex?
We are going to teach you how to gain massive confidence as a lover, all without performance anxiety, gimmicks, or prescription.
This course is perfect for you if you've ever been mortified by a sexual encounter that ended way too early.
Or if you've ever avoided intimacy out of fear that you won't last as long as your lover desires. Or maybe you long to give your partner multiple orgasms but can't last long enough to make that a reality.
Well, good news, we've got your back. And it's in our course, Last 10 Times Longer. Go to sexreimagine.com/last dash the number 10 X longer.
And for all of our favorite listeners out there, we are giving you a discount, 20% off, y'all. Just put in podcast 20, all caps, podcast 20 to get your 20% off of this phenomenal course that you're going to want to review more than once.
We cannot wait to see you inside this course. Plus, don't forget, we always got tons of bonuses. See you there.
I think when you can master these ancient techniques, the tantric and the Taoist techniques, I think when you can really feel the benefit of them in your body, then your beliefs start to change around that. And we all know that our beliefs create our bodies, and so we're carrying that. And so it is a tricky practice to get very good at, though. For some people are like, I got it in, a week.
It sounds like in combination with many of your interventions and of helping people, it seems like the two could really blend beautifully together, because I think you're right, Willow. I think part of the power of mastering your energy allows people to shift their beliefs.
Absolutely. Yeah. I think that, again, and I love what you're saying too, Anne, about everyone is so different on a different track. What is ED to one person might not be to another. And what, holding your semen retention in is for one person might not be to another. And so it's really about becoming the best doctor inside of your own body.
Absolutely.
You can seek out expert advice and support and guidance, of course, from experts like us, but you are the one in there. So you become the scientist of your own physicality.
Absolutely. And, I come with the resources, but at least I know there's no harmful thing if you do that. So I'm like, hey, to make you feel better, go for it. I can tell you, my husband, I wanted him to try to do this. And he's like, oh, no way. I like the way I'm old fashioned. I like the way it is right
he
now.
Likes to have the ejaculation orgasm. Yeah. Well, it's a very different experience. It's, and that's when we're guiding men and teaching them how to have non-ejaculatory orgasms, we tell them, don't look to feel the same kind of orgasm you're accustomed to. It's more of a full body orgasm. You get it shimmering and shaking all the way up through your central column into your brain. It's not all focused in the penis when you're having non-ejaculatory orgasm.
Well, let me ask you this: is there a woman way of doing that?
Yeah,
of non-ejaculatory as well.
Yeah, there's so many different ways of having orgasms as a woman, especially because we've got all this like amazing erectile tissue that's spread out. And one of the things the Tao teaches is the orgasmic upward draw. So we can bring orgasmic energy to different places in the body. We can bring it into the brain, to the pineal gland, to the heart, to the throat, to open up. And it's just a fun practice to explore as a woman.
Interesting.
I think what's interesting is there's also nerve pathways that are although we have the same, both men and women, how they run in the body are a little bit different. With a man's penis, he's got the vagus nerve, the pudendal nerve, and the pelvic nerve all running through it. Hypogastric nerve is running through the prostate gland and the anal cavity. Whereas women, we have the same nerves, but they're going to different erogenous zones. Some of them come together, some of them are separate. So with the clitoral orgasm, you have the pudendal nerve. With the G-spot orgasm, you have the pelvic nerve. With the cervix, you have the hypogastric nerve, you have the pudendal nerve, and you have the vagus nerve. So it's when you stimulate different areas of a woman's anatomy, the nerves that carry different feelings of orgasm can be separated. They can also be built upon each other. Men don't have as much variety when we're talking about the nerve experience. At least that's my understanding. What's your understanding, Anne?
Well, don't forget also the sympathetic and the parasympathetic. So with the nerve that you're pointing out are more somatic nerve. They're all somatic nerve, right? Well, except for the vagus nerve, right? Which is the cranial nerve, but there's don't forget the parasympathetic and sympathetic. And so you got a lot of nerve that are going to that central area because it's a very important area. So you have the autonomic nervous system, which is you cannot control that voluntarily. And then you have the pudendal, the hypogastric, the vagus, and then you also have You also have other essential organs in there, which is the bladder, and for a man, the prostate, right? For a woman, the woman version of the prostate, the Bartholin glands. That's her prostate gland, and then you have the urethra. So I call it Central Park as a lot of area culminating in a very small area, even. And so oftentimes it is controlling up here is what controls everything down there, right? Because I have seen men that are functional physically, everything works down there, everything works well, but because he's so he has psychological ED that he believed different things, that even taking Viagra in Seattle doesn't even help him with erection. It's that strong. And then once I did the test that I mentioned to you, the penile Doppler ultrasound, and show him, hey, everything down there is working fine, blood work's working fine, you're good, right? And this is a 30-year-old Marine. You look at him, he's a vision of health. I tell him, you're good, everything is good, you're okay. Just go home, have good sex with your wife. He called me up the next day and said, you all right? Yeah, I was able to get an erection, and
I'm
we
sure
had a great time.
sometimes they just need Dr. Ann to tell them that they're okay, right?
Totally.
Yeah, just to get their head in the game. They're like, oh, okay.
I'm really glad you mentioned that, because I'm seeing more and more younger men in their 20s and 30s coming through my office worried about erectile dysfunction, believing that they have it. I think they're more just worried that they won't be able to maintain an erection. Are you seeing younger and younger men in your office too?
Right. We're
do you
seeing
think
younger
porn
and younger men.
What's
porn?
What's the porn relationship
Porn
in all
diet.
this?
Yeah, the porn. It's really porn. The availability of porn, and the guys are vaping younger and younger now. They're playing video games, and they're eating fast food. They're not exercising. They're in front of the computer all day long. And in fact, if you sit in a chair, for a man, you sit in a chair for a long time, the nerve, the pudendal nerve goes from, underneath the scrotum and make a U-turn, go up to the penis. That nerve gets compressed. You sit for a long time, and it can, for a while, to get compressed, it can actually affect your erection. If you're like a truck driver, you're in your car for like 8-10 hours at a time, it compresses that nerve. So sitting down for a long period of time for a man, or even bicycling, can actually affect the nerve. So the reason why we're seeing a trend, even in men, when they're young, even a decrease in testosterone, because testosterone dependent upon diet, exercise, stress, and sleep. If you don't do any of those well, the testosterone level will decrease, especially sleep, because your body heals physically and from 10 p.m. to 2 a.m., and psychologically from 2 a.m. to 6 a.m. And so if you don't sleep well, then your body's not going to have a chance to heal. So we're seeing men in their 20s with testosterone level as if they're in their 50s. It's because really lifestyle factor. Now that's why blood work will tell us all of that. Will tell us whether he's eating well. You can look at his cholesterol, look at his blood sugar. You can tell us whether the kidneys and liver is working well. Because if you're drinking a lot of alcohol, you can see the liver enzyme go up. Alcohol, if you drink alcohol daily for like 3 months, it can affect the liver, and the liver can become kind of slow down and cause like a kind of a fatty liver. So we can see the liver, we can see the kidneys. Kidneys, a lot of times men don't drink as much water as well. So that will affect the ejaculate volume. They don't drink enough water too. So the younger guys, if they have ED, it's more lifestyle, what they're doing with their life. The lifestyle, rather than high blood pressure, high cholesterol, or diabetes, or prostate problem. Older men, over 50, we see more of we call metabolic processes, meaning high blood pressure, high cholesterol, diabetes, prostate problem affecting their ED. But when they're younger, it's really more porn, smoking, vaping,
diet, lack of exercise,
lack of
computering.
exercise.
Yeah.
So a couple of people that I've worked with, it's been porn and then hair replacement stuff. The stuff that they're
The
using,
hair
the fear of
replacement.
balding,
Yes.
has been causing, that medication has been having a really
Causing
adverse
ED.
effect
Yes,
to
yes,
their
it does.
erections.
Yes, the
Um,
finasteride. Yeah, the
yeah.
finasteride thing is that, if young men are losing their hair, first of all, get the thyroid check, get the vitamin D. Because when you have hyper or hypothyroid, you will lose hair. Or when you don't eat enough vegetable, you will have low vitamin D. 99% of us have vitamin D because we don't eat enough vegetables in the day. I have continually low vitamin D that I have to supplement by taking an oral supplement, and it gets my level up. But every man that I see has ED have low vitamin D level.
Oh, interesting.
Right? Yeah. So if men are not eating enough vegetable, they have low vitamin D, and that vitamin D also contribute to hair loss as well, too. So when we see a patient with hair loss, we do blood work. We make sure that their thyroid, the vitamin D level is good, as well, and also testosterone level. Testosterone level can kind of, in a way, affect the density of
Doesn't
the
high
hair.
testosterone cause balding? I heard that.
High testosterone only causes balding if it gets converted to another hormone called DHT, or dihydrotestosterone.
Okay.
Right? So testosterone's here, and then estrogen come from testosterone, right? And then testosterone can also become dihydrotestosterone, which is called DHT, which in high level cause hair loss. And then testosterone can also become, I mentioned about estrogen already. Yeah. So those two. So testosterone is the father of estrogen. I know,
But
women, we need to
DHT
know that.
DHT is normal inside of the body. It's just when it's at extremely high levels, which could be related to the liver or the kidneys, why it's doing that?
No, actually, when it's in high level, it's usually related to diet and inflammation and stress.
Oh, okay.
Yeah.
What supplements do you recommend?
What, for erection or for?
Well, yeah, for erection, yeah. Do you recommend any herbs or supplements? In
read
addition
her
to the other
book.
treatments?
Everyone get her book. It's all.
Yeah, we did talk about that, but I really like Tongkat Ali. Tongkat
Say that
Ali.
again.
Tongkat Ali. Tong.
Tonga Ali. Yeah.
Yes.
Spell that so I can put it in the show notes.
All right.
It's Tong. TAN.
I thought it was TO, but maybe I spelled it wrong.
TO. No, you could be right.
All right.
And
no, it is. It's TONGKAT, and then Ali, ALI.
Yeah.
All right. So we have a supplement here called Libido Plus, and it has Tongkat Ali, and it has Tribulus. It's spelled TRIBULUS.
Tribulus boosts natural testosterone in the body, right?
That's right. Mm-hmm. And Tongkat Ali as well. And then horny goat wheat as well.
Gotta have your horny goat wheat.
Yeah. Horny goat wheat and ginkgo extract, which is ginger. Ginkgo extract.
Great.
That's it.
Yeah.
Those are the things that's been researched and written about, and that's what we put in our Libido Plus. But all it does is increase testosterone.
Can you buy that on your website, Anne?
Yep. Go to my website at truongrehab.com.
Say it again.
The website is www.truongrehab.com. So truongrehab.com.
Beautiful.
Mm-hmm.
You've been just a wonderful wealth of knowledge. Boy, has it been exciting to talk to you. I feel so better equipped to support men with the things that you shared today. I'm really just so grateful that you came on the show, Anne. I'm sitting here just going, this is such valuable information. And I want to spread the good word. Hallelujah. There are things you can do that are effective and that are natural, and working with your own body and getting the appropriate testing, and then working with the tools. So many tools that you kind of bring together, Anne, so that men can feel confident again in the bedroom. Because this is something that feels so embarrassing. It has so much vulnerability connected to it. And it's something that they're so attached to in having a satisfying life. And when they start to lose their sense of sexuality and their relationship to their erection, it's deeply troubling, right? It's really painful. So this is so rich. Thank you so much.
Thank you so much for coming on the show, Dr. Ann. We love having you on, and it's just such a treat to pick your wealth of knowledge brain.
Yeah.
I would love I wanna thank you for reaching out and learning stuff that will make you so useful to all your clients that you're working with. They are very lucky that the knowledge that you have now really create a comprehensive picture of what you're working with, which is essential. And then now the medical knowledge combined with that, and that's why I'm learning from you the other aspect that is not the physical aspect of ED, because I feel that's an integral part of the man and the woman as well too, because I find it more challenging to deal with the intimacy, the relationship, the communication with the man after we treated the man, and then how he navigates from there on. Right. But one thing I do want to leave with your listeners is that if you are a partner of a man with ED or you're a man with ED, just know there is hope, and just know that there are alternatives to ED medication such as Viagra or Cialis, and there are alternatives for penile implant. I can't tell you, I'm seeing men in their 30s coming to see me because their doctor recommended they should get a penile implant. Now that I think is atrocious, okay? Penile implants, essentially you're getting the penis amputated and putting in 2 silicone rods in there. It is not something you want to do, because there is hope. If we're seeing men with their prostate removed get function again, your penis is a living organ. It can be revived, and you shouldn't throw it away. And so I just want them to hear this message that there are alternatives, there are hope, and that if they just seek, you all and us to work together, they will find the path towards functionality again.
And I do want to tell our audience that Dr. Ann has generously given you a free gift, which is the Good Morning Wood smoothie, I believe.
Yes. Yep. It is one of our most popular items. It essentially has fruit that you add in that will contribute to increased nitric oxide, and nitric oxide increased blood flow. And we have seen men just do this in the morning after they break their fast. I recommend that men do a 12-hour fast, meaning don't eat after 8 p.m. and eat, when you wake up, like around 8 a.m. and then break your fast with the morning wood smoothie. That could be your breakfast, and then eat again for lunch. It's an antioxidant. It also increases nitrous oxide. Drink it every day or even twice a day. You can put it in a blender, put some ice and your favorite liquid, either almond milk or water, and it's very tasty. So it's one of our bestseller. We've seen men just doing that, and they start getting results. And they start eating morning wood again.
Free gift.
Yeah, we'll have that in the show notes. And also, Ann, what's the name of your podcast?
So the podcast is called Sexual Health for Men.
Beautiful.
Sexual Health for Men. It's everywhere in Apple, Spotify, everywhere that you can find it. And our mission is to really disseminate information that is useful for men to restore their sexual health. And I base it off of research. I don't do a lot of fluff stuff. And I there's a lot of misinformation out there. And like you said, this is such a personal issue. It's an embarrassment. And the first thing they're going to do is start Googling. And when they start Googling, they're going to fall prey to, the ED medication and other stuff. Right. That may not help as well. So we want to kind of deliver no fluff information that we know has worked. We treated over 7,000 men with ED, and we know what works for them. And sometimes it's as simple as a diet. Mediterranean
Sometimes
diet.
It's just that morning wood smoothie. I mean, come on.
Yeah.
Could be easy, guys.
And
we'll
we've had the pleasure of being a guest on Ann's podcast. So we will leave that link in the show notes. Thank you so much, Ann, for being on the show. Please stay tuned because the dish is up next.
Now, our favorite part, the dish.
Oh my
Well,
God. Oh
what
my
a
God.
wealth of information.
That was so good. I felt like I
know.
learned so much.
I know. I love Dr. Ann.
Yeah.
I've been referring people to her actually since we did our first interview with her. Whenever I'm like, okay, I've done as much as I can do. Now it's it's not working. You got to go see the specialist.
Yeah. I think this, I always want to say platelets, but what is she doing?
The stem cell,
The stem cells. I think
which
that's
comes from
fascinating.
platelets. Yeah.
Right. I think that is so worth investigating. I
Oh,
think
yeah.
it's like, it seems like, okay, I got a cock ring and I do the stem cells and I do a penis pump every once in a while.
Yeah, and they do stem
Bam.
cell for all kinds of things: knee, elbow,
Oh,
low
totally.
back.
It's
all
the
the
latest
things.
thing.
It really works
Really
amazingly well.
regenerative.
Yeah, even the PRP. You could think about
What's
that as stem
PRP?
cell. That's where they centrifuge the blood and then put it into your face, kind of like the new
Like the
fancy
vampire
facial.
facial?
Yes, the
Yeah.
vampire facial, exactly.
That works
Yeah.
for erections? We should have asked her about that.
No, that doesn't work for
Oh.
erections. I'm just saying it's a platelet. It's kind of like a stem cell platelet thing that you can do for your skin.
I've never
for your
heard that the
wrinkles.
vampire facial also works for
For
erections. Well,
erections.
I'll be damned.
Well, we could maybe try that. That might be a whole new thing. That
Maybe we just put it on the penis and see
Yeah.
what happens.
There
The
you go.
magic of the vampire penis facial.
Oh my God. Yeah.
Yeah, wow. And it's really fascinating to find out just how much diet and sleep.
Diet is
play
huge.
a
That's the
role.
first thing I'm always going to is you got to start with a cleanse. Well, because most people are just dumping cortisol out of their adrenals constantly. And
Mhm.
so they need to reset their whole nervous systems. And doing a cleanse is one of the best ways to do that.
Yeah, and bioidentical testosterone to
Mhm.
regulate your levels of testosterone. Very interesting that would she say you lose 1% of your testosterone goes down every year starting
After
at age 35? Yeah.
Mhm.
Dang. All
Dang.
right. Well, we hope you just scrumptious information. We hope you really enjoyed that and that serves you in how you take care of yourself and how you take care of your beautiful penis.
Absolutely.
Because
And
your
let us
penis
know.
deserves all this love.
And let us know too if you would be interested in doing a little course, a little study work with Leah, Dr. Willow, and Dr. Ann, because we have
Yeah.
been chatting with her about it.
And
And we'd
collaboration.
love to know how many out there would be interested in that.
Yeah. So have a beautiful day. Have a beautiful penis. Have a beautiful life. We love you.
Ciao.
Thanks for tuning in. This episode was hosted by Tantric Sex Master Coach and Positive Psychology Facilitator Leah Piper, as well as by Chinese and Functional Medicine Doctor and Taoist Sexology Teacher Dr. Willow Brown. Don't forget, your comments, likes, subscribes, and suggestions matter. Let's realize this new world together.